One in three women struggle with urinary incontinence after childbirth, and over 30 million men suffer with erectile dysfunction. It's a common issue, and if you're struggling with any of these, there is a solution. Welcome back to The Root Cause with Dr. Jake. I'm Dr. Jake Schmutz. I'm a naturopathic medical doctor and integrative physician. On this channel, I have real conversations with real patients to show you how you heal your body down to the root causes without any harmful drugs or surgeries. I'm here today with my co-host and patient, Theresa Marie, to discuss the breakthrough treatment Emsella to give patients control, confidence, and intimacy back.
Thank you so much, Dr. Jake, for having me on the show today. This topic is very interesting to me. Being a 45-year-old woman who's had 4 children, and actually have had, I would consider myself a sensitive bladder my whole life. Like, even as a child, I was the kid that wet her pants in 5th grade. It was embarrassing. And so, you add in childbirth, you add in age, and, it's a real issue. And I feel very vindicated because when I've been on hikes with other moms and have chatted about life and all the things, and the bladder gets brought up because one of us at some point has to use the restroom while we're on the hike and need to dodge behind a tree or something to that effect. The topic of weak bladders get brought up, and I find out that I'm not alone. So I know that this is more than just for weak bladders. There's so much that Emsella can do. But if you can just, talk a little bit here, why are women and men even struggling these days with abdominal and pelvic area issues? What's going on?
So, what's going on is, for some reason, the pelvic floor muscles, which is this like little hammock or this little bowl-shaped muscle, is becoming weak. Well, we do know what's happening in women mostly is, okay, you have a vaginal birth, it's going to widen up, and that muscle there, that little hammock, is going to widen, and it doesn't come all the way back to where it was, and becomes weakened, and the muscle fibers become stretched, and they become weakened and not as strong. So that can lead to that. But also, just the aging process will lead to weakening of the muscle. But also, when we get heavier and we get bigger abdomens, which we are becoming more obese every day, it seems like, it's going to put more pressure down on the pelvic floor muscles and cause widening and weakening of those pelvic floor muscles. And then that's going to lead to various symptoms like urinary incontinence or erectile dysfunction or decreased pleasure in that area because those muscles aren't functioning how they should.
And it seems like this is becoming more and more common. I've got a couple of stats here that you had sent me, on how common this is becoming.
One in three women struggle with urinary incontinence after childbirth, and over 30 million men suffer with erectile dysfunction. It's a common issue, and if you're struggling with any of these, there is a solution.
So 30 million men in the US are facing erectile dysfunction. 1 in 3 women are struggling with bladder leakage. No wonder I think this device really comes at an important time. I mean, I know that there's other things that we can do. They've come up with all sorts of solutions for erectile dysfunction. You can have, like, I think there's, drugs that people can take, and exercises that they can do. For women, we've got our exercises, our pelvic exercises that we can do, our kegals and so forth. The Depend section in the grocery store is very long, lots of different options. I don't think a lot of us want to go there. That's the last resort. And so, when we hear that there's something that can help us that doesn't involve, these drugs or having to do all of these kegels all the time that kind of work, I think it's huge here. So if you could then explain to us, what is Emsella exactly and how does it actually work?
Yeah, so Emsella is a chair that was created, and it uses a technology called high fem. And what it does is it sends this electrical impulse, this high fem, which is magnetic fields that are oscillating back and forth, causes a strong or super contraction, super maximal contraction of the pelvic floor muscles. And this causes a very strong building of that muscle. So it actually treats the true cause of what's going on. It's not only treating the symptoms like medications, and you don't have to go under the knife. We actually just do a very simple procedure of sitting on a chair, fully clothed, just reading a book or a magazine, and getting 20,000 kegals, so to speak. Just think about it. 20,000 kegals is like 2 years of doing 30 kegals a day just in one session. So obviously, you're going to get much more better results when just doing the Emsella chair.
Yeah. So here, what kind of results are we talking about? I mean, obviously, 2 years worth of Kegels that we can get done in a short amount of time. What are some of the clinical outcomes that you've seen when patients have used it the way that it's intended and for the length amount of time that it was intended for? And what about men, men and women? What kind of results can they see?
I've seen really great results in my office. I'm really seeing at least 99% success rates. When we look at the research, that 95% of women and men are happy after their procedure is done. They got good results that they're happy with, decreasing their urinary incontinence and increasing their sexual intimacy. So I've seen really good results. I've only had one patient not get the best results when they had a prostatectomy, but he still got some results from doing this therapy. So yeah, it's just really going after that true cause of what's really going on. So we're going to have great results because it's going to really build that muscle and increase the muscle fibers in there and bring it back to where it was previously.
Okay, so now let's really think. I think more my question would be as far as like, how convenient is it, right? Like, if it's as difficult to do this machine as 12,000 Kegels, might not be very attractive to me. So is it cumbersome to use? Is it safe? What's that process going to look like for any man or woman that comes?
Yeah, Emsella is an extremely easy procedure to do. So you come in, you're fully clothed. I usually recommend that you come in some loose clothing without any metal on it. So you go in, just have some loose clothing on, you sit on it just like a chair. You position yourself in a certain way so you don't just slouch in the chair. You position yourself in a little way to open up your perineum, but you sit there for only 28 minutes, fully clothed, doing whatever you want. You can't use your phone when you're doing it because it's kind of like an MRI. It uses it's using magnetic frequencies to help these contractions to happen, so it could probably clear your phone. But you could read a book or read a magazine or relax, whatever. It's a very simple procedure. It's not cumbersome at all. I've never had any of my patients really complain about it at all because it's very simple.
Yeah, I had a chance to be able to take a look at some of the pictures and see some of the, experiences that some people have had. And it's exactly how it looks. It looks, we can have some B-roll that we can put on the screen here so you guys can see, but it kind of looks like a really large toilet in a sense, but without obviously the hole in there. It's kind of more of like a seat. And yeah, you just sit there fully clothed. Women talk about, having a bit of a kind of a tightening sensation, right? A little bit of that kind of a sensation. 28 minutes, you read a book, find it relaxing, and you're done. So convenience-wise, it seems quite convenient. For the average person, when you're looking at average bladder incontinence issues for most women and average erectile dysfunction issues for most men that come in, how many sessions would a typical person need, and over how many, what length of time? And then what does maintenance look like?
Yeah, so for urinary incontinence, erectile dysfunction, or sexual intimacy, this sessions is about the same. So we recommend 6 to 8 sessions, and we do 2 28-minute sessions per week. So it takes about 3 or 4 weeks of treatment, and then you start experiencing the improvements within that time. It's very, very quick. So what's really cool about it is it's causing a supramaximal contraction, actually building muscle better than just doing any muscular exercise like a kegel or whatever. It's really building the muscle much more quickly because we're doing a lot more contractions, but also we're doing a supramaximal contraction, which is really building the muscle quickly.
Okay, so my next 2 questions that I know I have before I come in. One, is average cost when it comes to some of these sessions so that, I can be planning out, what I can expect. As far as other doctors go, your office, I know everyone is a little bit different. And then I'll save my next question for after that.
Yeah, so the average cost for the procedure is $200 per treatment, and usually that's 6 to 8 treatments. So it's about $1,200 to $1,600 for improvement in this. We do recommend that you do some maintenance because it is a muscle. I do some, in my office, we do memberships. So we do a membership for only $59 per month to do maintenance. And I only recommend doing one a month. You might not even need to do that. We might be able to do it even just a therapy every 2 to 3 months to maintain the muscle and keeping it strong.
And I know that you actually have an offer that you've been using lately that's been bringing a lot of people in, where they can get their first session for $49, which I think is really good for anybody who wants to test it out. Because I wouldn't want to commit like necessarily, let me commit to 6 to 8 sessions if again, and I feel like I don't really care for the whole experience. $49, I can come in, I can try it out, see how it feels. Okay, can I do this? Can I visualize myself coming in twice a week for a couple of weeks here to get this? Now, one thing's for certain is even after that 49 initial introductory session, I'm thinking about my life. 45, I'm planning to live till at least 85. If I'm like my grandma, it'll be 95. And if by 45, I'm already experiencing the bladder issues that I have now, double that, I'm definitely on my way to Depends. And I don't want it. I don't want it. I want to be the grandma that's hiking with her kids. I want to be the grandma that's jumping on the trampoline with her grandkids. And I certainly don't want to be perusing the Depends section at the grocery store. So to me, this seems like a no-brainer investment into my health, my lifestyle, my future. And so that is amazing for me. Now, my one last question that I would have is I've been digging my own research when it comes to bladder incontinence issues. And I've learned that there's actually two kinds. So there is this kind where, and I have a lot of friends, especially ones who've had babies, who've experienced this, where it's almost like what you had mentioned, right, about weak muscles, and they'll sneeze or they'll cough or they'll jump on the trampoline and fluid comes out. But that's actually not what I struggle with. I can sneeze, I can actually jump on the trampoline, I can do all of those things at my age and have no problem. My issue is that I'll be hanging out and then all of a sudden I'm like, I have to go to the restroom. All of a sudden it's just like this sudden urge that I have to go. And it went from nothing to, oh my gosh, I better run. And sometimes I'll run and I'll use the restroom and it's a full bladder. Okay, that makes sense. Full bladder, all of a sudden you have to go really bad. I get that. Sometimes it's not. Sometimes I run to the restroom and I'm like, are you kidding me? That's what I almost peed my pants on, was that? It was like a half a cup of fluid. What's going on in that situation? And is that something that Emsella can actually help?
Yeah, so there's two forms of urinary incontinence. We have stress incontinence and urge incontinence. The one you're talking about is urge incontinence. So you're just sitting there, everything's all good, you're eating dinner, and then boom, it just hits you and you have to run to the restroom. This is caused by poor neurological stimulation and also weakening of the pelvic floor muscles. And Emsella is great for both of those, strengthening the pelvic floor muscles and also helping with the neurological signaling that is happening to the bladder. So Emsella is great for urge incontinence. Also great for stress incontinence, like you were talking about, jumping on the trampoline, sneeze, cough, running, etc. You get a little bit of fluid that comes out. When you do this helps strengthen the pelvic floor muscles, and that's the major cause for both of these. Weakening of those pelvic floor muscles and weakening of the neurological signals that are going there. And HiFem, with the technology that it works, is setting this magnetic signal into the pelvic floor muscles, causing these rapid changes that are happening, causing electrical impulse into the muscle, causes then building of that muscle, more myofibrils, and makes it a very strong muscle again, back to where it was, or maybe even stronger than it was before.
Well, Dr. Jake, thank you so much for being able to answer my questions on this. For those of you who are listening and you're like me, or you're a man and you're dealing with the erectile dysfunction issues and you're listening to this and going, okay, this does sound like something that's worth trying. You can give Dr. Jake a call at 801-938-7965. And you can schedule an appointment there. There's that $49 deal. We're going to put that link for that $49 deal in the description box, so you'll be able to click on that, test it out, see if you like it, and then if so, do your 6 to 8 sessions. Dr. Jake?
Yes, if you want to learn more about bladder incontinence and erectile dysfunction and you're watching YouTube, click my video to the right. I'm Dr. Jake, and I'll see you there.